Welcome back to Studio 10.
For many patients and their caregivers, the changes to Medicare have been confusing, but Viva Health wants to make it easier to start your health care on the right foot. Ann Lyles from Viva is here to answer some of the most common Medicare questions. Ann, good to see you this morning.
Thank you. Good to see you too.
All right. Thanks for being here. The first question we have is, there's been a lot of misinformation regarding Medicare and health care reform. What is Viva doing to address this?
Well, Viva Medicare has actually been very proactive from the very beginning. We've been conducting Understanding Medicare seminars across the state. And some of the common misconceptions about health care reform is that Medicare is going away or that Medicare Advantage plans are going away, but neither is true, thankfully.
Well, when can someone change their Medicare plan?
Well, typically any time during the year, but only if they have a special election period. If they don't have a special election period, they can only change during the fall, during AEP.
AEP.
Yes.
We hear a lot of confusing terms and things like that people don't know what that means. So what is AEP?
AEP stands for the annual enrollment period. It happens just once a year. It begins October 15th and ends on December the 7th. And basically during that time, anyone who has original Medicare can make changes to their current health care coverage.
Annual enrollment period. Pretty simple.
Pretty simple.
So what kind of coverage options are available for someone with Medicare?
Basically, there are two options. Number one, they can choose a Medicare supplement plan along with a standalone prescription drug plan, or they may choose a Medicare Advantage plan that has hospital coverage, medical, and prescription drug coverage all under one plan, which is actually what Viva offers.
All right, so are those the type of things that people should consider, or what should they consider when they're looking for enrolling in a plan?
Well, every individual is different, so of course some factors may be more important than others. However, I think that if everyone could ask themselves a few questions such as, are my doctors and medications covered? Will I have coverage if I travel outside of the service area? And then, of course, you know, will it be easy for me to get my questions answered after I enroll and once I'm a member? Viva is very proud to say that, you know, whether it's on the phone or face-to-face, you will be able to talk to a live person.
All right, so how do people do that? How do they get in contact with Viva?
Well, Viva is very unique in that we are the only insurance plan that has retail locations across the state where somebody can just walk in and ask questions and talk to someone face-to-face. Now, our local office is located at 907 Hillcrest Road, Suite G, and then for those people who may be traveling north of here or have family and friends who may want to travel north of here, we have offices in Montgomery and multiple offices in Birmingham.
And we'll have a link to all this information on our Studio 10 webpage as well, but they're going to make it a lot simpler for you. We said that this can be a confusing process. All you need to do is stop in and get all your questions answered and get you down the right path. Thank you so much for coming in today.
Thank you.
Very helpful.